Good morning, everyone, and thank you for joining us today. I am James Simoes with Protect Our Care New Hampshire. We are now entering the third week of the federal government shutdown, and the impacts on healthcare, especially here in New Hampshire, are becoming clearer by the day. While Medicare and Medicaid continue to operate, there are some big challenges over on the Medicaid Advantage side rather, and thousands of granite staters are soon at risk of losing affordable health insurance. Providers across the state are bracing for funding gaps and administrative slowdowns. And in less than 2 weeks, open enrollment for the Affordable Care Act begins, and we have little information on the rates or the future of extended tax credits. So the stakes could not be higher. So I'm bringing you today two New Hampshire residents who can help us to unpack what this means for affordability, for coverage, and the health of our communities. So I want to quickly give them the time to talk. And I want to start with Representative Janet Lucas. I want to thank you for joining us. Representative Lucas, it's good to have you here. You represent rural communities in a rural district where access to care is already a challenge. How is this shutdown and the uncertainty around federal health funding affecting people in your district?
Well, in very serious ways. I recently heard about an individual who had a heart procedure scheduled, and the transportation had been arranged. And for whatever reason, the driver didn't show up. So that individual ended up being put on a no-show list through no fault of her own, because she had been very careful to arrange the transportation. And then it was on an open-ended date when she would be rescheduled. Well, 2 weeks later, she had a heart event and ended up in the emergency department, and ultimately a nursing home, which was not her plan. But it's that kind of transportation insecurity that we're already dealing with. And then you add on top of that the burdens of cuts to Medicaid and in general, and to the ACA in particular. And we're just going to hear about more and more of those stories.
Well, thank you. And I want to say, when we're done having this chat, we're going to open up questions for the media who are here. So if you have a question, we'll give you a chance to put it in. But yeah, thank you. I want to say that's an important reminder. These are not abstract policy debates. They
Right.
affect real people in communities across New Hampshire, especially rural communities. Kristen, the video, it's good to see you again. Thank you for coming back. And you've been tracking both economic and operational fallout of this shutdown. Can you walk us through what you're seeing at the systems level, particularly around coverage, access, and affordability?
Thank you. There are a lot of things that are kind of conflating together right now, certainly. And so it's not just the shutdown. But when we see premiums increase, when we see people lose access to care, or when barriers are increased to them getting care, even something as small as requiring a copay for medication for people who didn't have to cover that before because of the health care that they were receiving. They do seem small sometimes, but when your budget is small, when you are working two jobs that don't pay that well in order to cover the expenses for your family, when you have increased pressures around now needing to check in more often, go to more meetings, possibly it's getting to the meeting and you don't have your own stable transportation. There's all these layers that happen to people that are financial. They are part of the system, and they increase the burden, because the people that are most impacted always are the people with the least amount of power over the situation. And that's always what happens. And so we really need to think about that when we're putting things in place that seem like they are fiscally sound. We're making a financial decision, but there are unintended consequences of every action that we take. And then there's also the workforce. There is the federal shutdown means that there are people in New Hampshire that are either going to be unemployed or they're furloughed. That's part of our workforce. There's also people that work in state government whose programs receive federal funding that aren't now, maybe, right? They know they aren't, or they might not be. So now, because we have to fund the rest of it through the state budget, we may not be able to. So we're seeing program closure. We're seeing, people displaced out of jobs and back into the labor market, which is doing poorly right now. Like, there are just so many layers of this right now that we need to watch out for people, because the burden falls on the community in the end. It falls on us, every one of us.
Well, thank you, Kristen. I think you're describing a system that's stretched its limits, and even short disruptions in funding or staffing could ripple through our hospitals, our insurers, but to your point, our families. I'm just looking at the numbers, and if Congress doesn't act soon, these enhanced ACA tax credits, which are so important to the Affordable Care Act, and help many of the 70+ thousand granted staters who signed up to get affordable coverage through the ACA, are going to expire, which means that the average monthly premium for many families could more than double next year. Double. And nationally, the Congressional Best Budget Office is estimating that more than 4 million people could lose insurance if these subsidies lapse. And for those who keep their plans, rising costs could make coverage unaffordable and worsen an already fragile New Hampshire healthcare market. So I just want to move on to ask each of you for a quick takeaway. What needs to happen now to mitigate these impacts and protect New Hampshire families? Deanna, if you want to go first.
Well, I wish I had a magic pill for this problem, but New Hampshire has been defunding some very important programs for so long that it's cut to the bone and beyond. And now we are in a situation where additional cuts will force the closure or discontinuation of the very programs that save money, particularly home and community-based care. Folks would much rather receive their care in those settings. In an allied sort of survey, 95% of seniors would prefer to age in place, for example, rather than end up in a nursing home setting. And that certainly would apply to younger folks who are at risk for losing their coverage with Granite State Advantage, which is the ACA or the extension program here in our state. So many of them, literally 60% of those folks, are already working full-time or part-time, and they simply cannot afford coverage. So without ACA, they will lose that coverage. They will go on to make decisions based on budgets that cannot support adequate nutrition, housing, transportation, healthcare. And healthcare will probably be the one that gets bumped off the list of affordability. And now we're talking about not only the adults who are covered, but the adults that they may be providing care for. A lot of these folks are full-time caregivers, and perhaps attending school full or part-time. All of those lifestyle choices, all of those futures will be interrupted when they lose their access to this coverage.
Well, thank you, Representative Lucas. I really, really appreciate that. And Kristen, it looks like there's no end in sight to this thing, right? I mean, the Senate votes time and time again to passing that they're not going to pass. The House has gone home. We're not hearing about negotiations and backrooms. And as this gets on, it gets difficult. So, I asked my question, what needs to happen now to mitigate these worsening impact on New Hampshire families and communities and our healthcare system?
We're
I mean,
not in a position to really act now at the state level. The insurance commissioner, DJ Betancourt, in discussing what's happening to Medicare Advantage, that's not Medicaid, but pointed out that they're boxed in and there's very little they can do about those programs leaving the state. So the same most likely applies to the Medicaid Advantage plans. So now we're having access to fewer programs, and we're not seeing the kind of response that we should through legislation at the state level to protect those folks. Instead, there's this attitude that healthcare is a privilege and not a human right. And as long as healthcare is regarded as a priceable commodity, we're going to be up against this over and over again, where we cannot recognize that healthcare benefits everyone. And when it's removed, then we have sicker folks, the most frail people being affected, and they won't have preventative care. They won't be able to afford their medication, and they will ultimately end up in the emergency room and being hospitalized at a much higher cost. So we really have to reorient ourselves in terms of the state legislative process. And given that we've gone in the opposite direction for many years, probably a decade, long before I began serving, and I'm a first-term rep, this problem is nearly endemic in the state. So it's going to require a lot of work, but we have to have a fundamental change in how we look at healthcare before we can do that.
Thank you. Thank you for sharing your expertise and your perspective. Christin, let me ask you, we know that 90-some% of the funding to the Navigator program has been cut in the state. There's not a lot of folks out there to help people in open enrollment, and now there's all this confusion and delay going on. Christin, is there anything from your perspective you can see us being able to do now to prepare for the storm ahead? Again, as this shutdown goes on and could go on for a very long time.
right. I mean, if it continues and New Hampshire is going to step in and continue to fund programs, then we're funding things we don't have money allocated for because we're going to take up the slack, right? So it's going to impact the budget, and potentially we don't know what the outcome will be if it ends up that at the federal level a change is made and we don't have the funds to cover what we've already covered. It is difficult to navigate through the systems for anyone. It's not, if you've never applied for any of these programs, it's not easy. Maintaining what you're supposed to do while in the program is not easy. And that's a burden put on people who are maybe also looking for a job, trying to care for another adult individual, maybe, which now, is that funding going to be cut? Telehealth, just things that make it easier, things that came up during, the pandemic. We realized, okay, well, we're rural. Older people might be relying more on telehealth because they don't have to transport themselves to an appointment and leave. There's just so many things. I mean, where is the resolution? People have to look, those people that are making decisions around the laws have to look at, do they have any common values together? Because that's the only place you're going to find agreement and compromise. What are your values and where can we move together? Because I think at the end of the day, people are trying to make what they think is the best and most humane, fiscally responsible decision. But it's, that we have to have some sort of agreement where we can protect people, because it's going to be veterans, it's going to be low income, it's going to be rural, and children. Those are going to be the people that are so impacted, people that are disproportionately, not receiving services right now will be impacted.
That is the unfortunate truth. I want to call my colleague Rachel in at this point because I know we've got some members of the press who can ask questions of our panel using the Q&A feature. Is that right, Rachel?
Yes, thank you, Jime. That is correct. And thank you, everybody, for joining us on today's call. We really appreciate it. As Jime said, if you have any questions for our speakers today, I invite you to please drop those in the Q&A box at the bottom of your screen. And if you have a question for a particular speaker, please just note that in your question, and we will direct that. Now, our first question was submitted ahead of time by somebody who couldn't make it today. This is for Christin, and that is, could you just say more about how a loss of EPTCs would harm not only our health, Granite Staters' health, but their personal finance?
Well, so when we're looking at coverage and care, we're watching costs rise across the board. The New Hampshire Fiscal Policy Institute just covered this. So that we're seeing medical costs, food and housing costs are just increasing. People's incomes are not proportionately keeping up with the rising costs. And so people scale back on what they can scale back on. And that is food, that's preventative medical care or just medical care in general. And maybe types of housing, things that need to happen. So, we're seeing things that we know impact people's health at a holistic level. It's their mental health, behavioral health, it's chronic stress. Those things start to come into play. And they relate to each other. So it's not just these financial impacts, it's the health impact on the family and each individual. They're tied together.
Thank you, Christin. And for Representative Lucas, a question similar to Christin, but could you just say more specifically on how you're concerned for your constituents in particular if we are to lose access to enhanced premium tax credits and premiums are set and premiums rise?
Well, you're looking at, I think, a degradation of the health system, especially in the northern counties, and with the loss of the ACA program, it will create financial stresses among providers and rural healthcare institutions, particularly our critical care hospitals. If folks lose access to those centers of care in the rural areas, and they don't have access to transportation, how, for example, will a woman be able to obtain normal routine prenatal care if she's got to find transportation that's going to require a 2 or 3 hour drive instead of a 45-minute drive? And that's what we'll see, especially in Coast County. And the community as a whole will have to absorb the costs that aren't covered when providers aren't reimbursed. So those costs will be passed on to the only folks who are a remaining source of revenue, and those are people with private insurance. So costs will go up. So everyone else in the community will eventually have to absorb the cost of keeping that hospital open, keeping the other services available. I'd like to point out that it's certainly a cost savings being able to provide home and community-based care. And if those agencies are not funded adequately, they will close. And then you have folks who were receiving that care, getting support for taking their medications on a regular basis. And they will have a diminution in their quality of life. They will also experience greater healthcare challenges, and they'll be the folks who present to the emergency room much more frail and sicker, and ultimately cost us all more. And that's a problem that's exacerbated in the rural area of the state, given the problems we have with adequate providers. We have a staffing shortage. We have a workforce emergency, and we're already dealing with those issues and trying to perform the care where we are.
Thank you, Representative Lucas. We have a question from David Brooks from the Concord Monitor, and that is asking if anyone would be able to list in a handful of specific programs that may end in New Hampshire or significantly lose funding that might require them to end due to the shutdown.
And there's a couple options here. I'll leave it to the panel, but we know, Head Start, it's a preschool early childhood program, but it has a lot to do with, care and wellness. Its funding is annual and contingent on congressional appropriation. If the shutdown persists, the program would end without funding, and that would be a huge blow to New Hampshire communities like the ones that Representative Lucas, is here to represent. And then I think, Kristen, you mentioned SNAP as another, the Supplemental Nutrition Assistance Program is under threat. And I mean, do you have anything else to add, folks? I mean, those are the two that come to my mind immediately.
Yeah, I mean, it's hard to know exactly. There are some programs that will just be unfunded, and then there are some that are going to be so partially unfunded that there's going to be a decision made, and I don't know the answer of what decisions are going to be made around that. But I know that we're looking at all these things at this time when there are also, programs at the federal level that have gone away, and they may come back, but things such as loss of CDC employees, we're kind of like at this risky point where there are large things that could happen once again at a global level, and we're ill prepared to handle them in this moment, and then layer on top of this what else is going on. It's just we're all connected by our health. I think we learned that already.
And a threat was made a couple days ago by the president that if the shutdown continued, that Democrat programs would be on the chopping block. He wasn't specific as to which programs, but I think we could all take guesses, right? Any other questions, Rachel, or anything else to add?
That is all from me and from our media today. So thank you everybody for participating in this Q&A. Jaime, I'll turn it back to you.
Thank you, Rachel. I want to thank Representative Lucas and Kristen's video again for joining us. I think you've helped make very clear that this shutdown is more than just a political standoff. It's a direct threat to the health and stability of families across our state. So I hope that the whole thing ends soon and we're able to put things back together before open enrollment happens. So I want to wish everyone to stay safe and stay engaged and hope that we can all keep working for the better health and care of all Granite Staters. We'll be back in a couple weeks to take a look at open enrollment, where that's going and what we know, because right now there's a lot of unknown. But again, Representative Lucas, Christin Video, thank you for being here. And to the media who joined us, thank you as well. We appreciate you engaging in this conversation. On behalf of Protect Our Care New Hampshire, we'll see you soon.